I think health sector has evolved to the point that all the technological advancements now need to be put into use efficiently. And that is where we are failing, which means that our systems are too complex, they are too fragmented, and we are getting far less out of a health system than the potential actually would allow us to do. I'm an optimist, which means that in 10 years' time, I truly believe that patients are in control of their health trajectory, which means that it starts from the prevention. They are aware of their risks. They also know what is in their hand. There is a system that supports their healthy choices. But if they fell ill, but if they would fall ill, there would also be multiple entry points. But they would all be based on the same data and information about the individuals. There are earlier choices, there are activities, and then there are teams of healthcare workers that collaborate, but they don't necessarily reside in the same building. Instead, I believe much of the health encounters happening at patients' home, in the workplaces, and hospitals, probably good for surgeries, maybe some intensive care, but increasingly so, it's early detection and close to the patient treatment. Well, digital technologies can do two things very well. First is that they can compute, which means that the everyday enlarging amount of information needs to be processed, and it is not possible to do by humans. So we need computers to help in decision making. We need also computers to do the other thing, which is help us to communicate better, which again means that those different professionals who are not necessarily in the same room can have access to the same data. The data can be translated in a way that others can understand it, and it can be combined in a way, so image information with data from laboratories, but then also patients verbally expressing their feelings. All that data needs to be liquid at the time and at the place where this encounter takes place. Well, I do think that healthcare systems have evolved to the state where there are many vested interests, and then there is by different stakeholders actually even, fear that if things are going to change and if patients are taking more control, they will be the losers. So I do not believe that mankind is spending less money on health because health is becoming more and more important, but I just mean that rewards, financial rewards, to be given to them who generate most value. So if we get to the value-based approach and then align the incentives for all the stakeholders around those values, I believe there is a lot to gain by everyone. And if this acknowledgement is being recognized, it starts usually from smaller groups coming together, finding, okay, where is this win-win-win? A smaller kind of services, but deployed at scale, which means across the whole systems. It can start from supply chain, but it can be also monitoring chronic diseases and then rewarding different stakeholders that contribute to this monitoring and treatment. And gradually, this trust towards this new philosophy, patient in the center, data as the basis of decision making, value as the common goal, I think we get there sooner than we actually expect. Well, full disclosure, I've been the fan of ECHAlliance since 5-6 years, and I always come, which means that to me it's not anymore a curiosity. To me it is the confirmation from previous years that you learn here when you come here. You meet the people that otherwise would be difficult to meet, and you just get a new revelations by talking and being at the place with such vibrant atmosphere.